All right, so good morning, and it's very nice to see you all here. We do have quite many people in our meeting today. My name is Olga, and I'll be chairing today's session. I am a PhD student with the Open University Business School, and I'm doing my PhD. It has been second year. I'm second year into my PhD, and I'm quite new to the field of business management studies. I'm coming from communications, and frankly, that's going to be the first session I'm going to chair in this new status in the new discipline. So bear with me if I be asking some two communication questions. And it's very good to see you all here. And today we're discussing the issue of rebooting public leadership. We do have three brilliant papers, one on leadership in healthcare, another on leadership in state governance, and on police leadership. And they all are touching on the controversies of this disruptive environment we are currently living in. I'm anticipating a very, very interesting session today. So we do have three presenters and a little bit of housekeeping. I assume that each of will have 15 minutes to present, and then our hygiene, and then we will have no worries at all. Just moved on to the housekeeping. So we will have 15 minutes for presentation, and I warn you when there will be 1 minute left, but it doesn't mean that you have to stop immediately on anything. And then we'll take questions probably straight after each of the presentations, trying to keep them up to 10 minutes, and then we'll have a little bit of the time to wrap up. So again, thank you so much for joining us. And our first presenter is Charles. Charles, if you could press this take control button, you will be able to then upload and share your presentation.
Yeah, absolutely. Thank you so much. So, all right. So I'm going to talk today about someone who you might have heard of in the media, but potentially not, because you're not based in France. But this person became extremely famous, who was not famous at all before COVID, and became extremely famous all of a sudden in the context of COVID. So this person is in fact probably the one or the top 5 most cited French scientist, and he became famous because he advocated the use of hydroxychloroquine. And I'm going to try to analyze what happened there and how this took place and what type of leadership discourse this was linked to. One thing to bear in mind is that not only he became extremely famous, but also this was linked progressively to a number of social movements associated with the anti-COVID pass movement and also the anti-vaccination movement in 2021, in addition to a huge presence on digital platforms and social media. But let me start. Okay, so this is the structure I'll try to use today. So I'll provide some context. I'll say a few words about COVID-19 public discourse and crisis management. I'll say a few words about what I think might be a theoretical problem or a contribution, interesting contribution in relation to this case, or at least what is my thinking at this point about this. And then I'll mention a few words about essentially my provisional hypothesis at this point about this case and what this case might be interesting about for the leadership literature. Let me start with the context. So hydroxychloroquine, HCQ, let's call it HCQ, is a modification of chloroquine. It's not a new medicine. It's not a new medication. It has been used now for several decades to treat malaria. Everyone agrees in the medical community that it is effective to treat malaria. It is cheap and massively used. Now, millions, in fact, hundreds of millions are using it as we speak now in various areas of the global south, primarily. At the beginning, people were discussing it as a legitimate medication. So on the right-hand side at the bottom, you see a picture, a snapshot from an article that was doing that was testing the use of HCQ at the beginning of the pandemic, around March, April 2020, and essentially it says it did some tests and so on. It says, I quote, "The result of this study does not support its use in patients admitted to hospital with COVID-19 who require oxygen." So people were already a bit skeptical, but they didn't really know. And then in June, and here you have a snapshot from the World Health Organization. In June 2020, it was confirmed that based on a randomized and very large study, it was confirmed that HCQ didn't work. So after that, it increasingly it would become only supported by people who would believe in variations of conspiracy theory. Anyway, speaking of which, Donald Trump has been a huge supporter of HCQ, even as skepticism was growing. So there was a kind of let's say cultural resonance between HCQ and right-wing populists who didn't want to acknowledge that there was a public health crisis. So it's not by mistake that Trump supported it for some time, at least. Here's Professor Rao. A few facts about him. So last time I checked, he had a staggering almost 190,000 references on Google Scholar. I didn't know that was possible. So he's extremely cited. He's a microbiologist. He's also a leader in the sense that he owns a very large, let's say large organization. So he's the head of the Infectious Disease Institute of the Marseille University Hospital. So that university hospital is one of the biggest in France. It has 80,000 students and so on. But the particular unit he manages is a 700 employee unit, including researchers and admin staff, and it has managerial and budgetary autonomy. So I checked on their website. So they say they had around 75 million euros for building for 4 years from 2013 to 2017, and around 35 million euros for equipment between 2010 and 2017. This is without personnel. So this means that roughly speaking, if you do the math, it's probably, he would be managing probably a budget of between 20 or to 30 million euros a year if you take into account personnel. So anyway, he's in charge of a significant organization, of a significant research organization, and he was and he's still recognized as an important microbiologist. despite this HCQ controversy. So, okay, what happened, as we all know, public discourse, I mean, COVID-19 is linked to huge amount of public discourse, and a lot of this discourse was about crisis management and about different types of discourses coming from the government, but also different types of actors and stakeholders about how to deal with the pandemic. I'm not going to go into that, but it was very clear there were phases which were different in different countries. So, for example, in France, it was denial. Then they said masks weren't important. Then there were a number of debates around ventilators. Then there was the phase with max vaccination and so on and so forth. Anyway, going back to how he had somehow he interacted in this context. So his first video shared on his organization's YouTube platform, YouTube account, I should say, at the beginning had 450,000 views. First one on HCQ. Second one, where he was already so first one, he was minimizing the risks of COVID-19. The second one, he was already talking about HCQ. At the end of February 2020, 750,000 views. And the one where he said his organization had delivered studies that supported the use of HCQ to cure COVID-19. This video, this is really important, was released just one day before the announcement of the first lockdown in France, had 1.5 million views. Now his Twitter account, and you see a picture of that at the bottom, he has more than 800,000 followers, and his Facebook account, this was measured by, and I mean, I have this data from an article that I quote. So they did a quantitative analysis. So basically, the posts on his Facebook account were shared on a particular week of March 2020 more than any major newspaper in the country. So it would be like if a single individual's Facebook's account would be more shared than the Guardian or or any other or the BBC, perhaps not the BBC, but let's say the Guardian, which is again something incredible when you think about it. He even had an article by the Financial Times, as you can see there. Okay, so here you can recognize President Macron on the left-hand side. So in April 2020, he was legitimized by the further legitimized by the publicly when the president visited him in his own organization, and you see here he's in his office and having a discussion with the French president. The president visited him as the official public health authority was already criticizing HCQ at this point. It was April 2020, but nevertheless he did that. So okay, so why is that interesting at all? It's an interesting case to see how someone who is legitimate who is a legitimate expert is using that, is mobilizing that in order to contest science. So I guess it would be a way to understand how science intersects with populism in terms of a leadership discourse, because obviously his discourse has been extremely influential, as the figures I mentioned earlier suggest. So okay, so my idea in terms of theoretical articulation would be to use Laclau's discourse analysis, which involves to take seriously this question of populism, which involves to identify antagonistic frontiers, discursive frontiers, usually against elites, and equivalential chains between heterogeneous democratic demands constructing of people. So, for example, of people who demand social justice and other people who would want environmental justice. So, and other people who would want gender equality and so on and so forth. Here's a picture of Perón, who is a major Argentinian populist leader because Laclau used him as one of his cases. Another point that is important for him, for Raoult, is the crisis context. This has been conceptualized quite a lot. So there is a recent paper from Smolovic, Jones, and al., where they see terrorism as a crisis context where a particular form of leadership can be deployed. They call it sovereignty leadership. Another important point here is the digital element, because as you've seen, this was one of the channels through which he was Rose became famous. So in terms of methodology, there's a lot. There's too much. So I would have to focus on stuff. So what do I do to deploy my critical analysis? Should I just look at his YouTube videos that are posted on his organization's YouTube account? Should I look at his books? He has written 2 or 3 books already based on that. His interviews, he has been interviewed many times in mainstream media. What about his interaction with social movement organizations? What about his own organization? What about the broader political debate? So there's a methodological problem here. I'll just use, I'm conscious I have talked already for around 15 minutes, so I'll present my initial findings or my hypothesis at this point. So first of all, what's the role? So as you can see, this is a picture from one of the actual social movements, which explicitly mentioned his name. This is an anti-COVID pass, anti-vax demonstration in France. So okay, what about his organization? He has essentially captured resources from his organization at this point, as far as I can see, either material resources or symbolic resources. But he was mostly speaking as himself. He wasn't really deploying some kind of collective leadership in the communication, at least. In terms of the antagonistic frontiers, let's say, there's a clear critique of big pharma, a critique against French and global elites, both political and corporate. In particular, he has developed a form of conspiracy theory around the Lancet, for example. He would say that the Lancet studies are not reliable because of their so-called ties with big pharma, and also because this is linked in his idea because of a kind of industrialized methodology of science based on randomized tests, whereas he would defend a kind of artisanal vision of science linked to empirical observation of particular patients. He has also critiqued the COVID pass and that indirectly critiqued vaccines, or at least the impact of vaccines. In terms of who he articulates, he clearly, you have this idea of the people as the French vs the French people vs the foreigners, because of big pharma is supposed to be kind of globalized entity, which is in opposition to an authentic French people, quote unquote. And also you have this idea, so you have this opposition between people and elites, because he's also critical of the French government, who would be in the same conspiracy with big pharma and the Lancet, I guess, his perspective. And also you have an opposition between national public health, which is, you know, like pretty much like the NHS in the French context, against a marketized and globalized healthcare symbolized by big pharma and so on, and what he thinks is a conspiracy. Final point, which is interesting, is that he kind of articulates demands to democratize science. So a lot of the people on the internet, but also in those demonstrations and social movements, were asking accountability about science and so on. So they were asking, in a way, democratization of scientific expertise. But what is paradoxical in a way is that he mobilized, so he articulated some of those demands, but he mobilized his own expertise, but without accountability, because he was not, you know, he was not really, he was trying to escape accountability in a way. This is linked, and this is a point that I made with a colleague in a paper, but that is also made by Charles Barthold, the author I mentioned, who studied platforms and political organizing. What happens is that the only contact of Raoult with the social movements and, let's say, people on the ground was through those huge digital platforms, which enabled him to mobilize an incredible amount of people in no time, but at the same time, which created a kind of ephemeral link. So, in other words, on the one hand, there was no accountability because he was not elected, essentially, by the people in the demonstrations or the people who are his followers on Twitter. And also, as this is very ephemeral, perhaps this will disappear at some point. He's also clearly supported by the right-wing populists. Explicitly, like in public discourse, Le Pen has supported him, and here is one prominent far-right politician who is saying, I quote, Raoult is attacking France, where you see this kind of populist gesture where he's kind of associated with a form of national public health, which would be threatened by elites and a globalized healthcare system dominated by big pharma and so on. So here's where I am. I'll stop now. I have spoken too much, so I apologize about that. So over to you, Olga.
Thank you so much, Charles. That's a very interesting topic on becoming a pandemic rock star, especially when it emerges on the intersection of the right-wing populist rhetoric as well as the scientific expertise. That's very interesting, very dangerous. That's quite scary path we can step on. Unfortunately, we've seen too much of this over the past 2 years. Any questions, please? If you could raise your hand if you have a question to ask. Feel free to do so. Would you have a few minutes to do that? Keith, please go on.
Hi, Charles. Thanks very much for that. I was just reflecting as you were talking about the work of Mackenzie from 1990 on missile accuracy. I don't know if you know his work, but one of the conclusions he makes is quite interesting as a reflection onto your stuff. He argues there's a kind of inverse correlation between knowledge of science and confidence in it. So that the more you know about it, the less confident you are about it, which is the kind of reverse of what you might normally expect. And I think that seems to gel quite nicely with some of the arguments about the anti-vaxxers, that they know virtually nothing about it, but they're extraordinarily confident about how useless it is.
Absolutely, you're absolutely right. So going back to Raoult, he's he's smart in a way because he wouldn't just be, let's say, a vulgar conspirationist. So he didn't really say vaccines, anti-vax people are right, or vaccines are, are a scam. He would say things like, "Oh, I found there is no study that shows that vaccines." He would be a bit more subtle. There is no study that shows that vaccines are effective. Or he would say he's very skeptical about what results have shown to this date about vaccines. But of course, he would have a double standard, because when all studies have shown HCQ is not effective, he would still say, "Oh, it's because you have those." Then he's really conspirationist about, about big pharma and so on. He would say, "Yes, but those studies were funded by Pfizer or whatever, and in this case, only my studies are reliable." But the crazy thing is that this guy is not. Is a real scientist. There are controversies. Some people now are trying to check everything he did in his life, and some people are starting to think that he kind of did, manipulated results. But it's quite unclear, and most people, including his colleagues who don't like him because of what he did with COVID, agree that he's really really smart and so on. But what they would say is that he's an expert, in fact, in tropical diseases, which have nothing to do, like malaria, therefore this thing with the HCQ. But they would say he knows nothing about, lung infections and COVID, but he's literally one of the best experts on malaria and tropical diseases. It's just that he's talking about something he doesn't know when he pretends he does it. But they wouldn't say he's an absolute he's just lying all the time. And the crazy thing, I'll just stop with that. And what I think is really crazy is that he's a real scientist, but he uses that to spread what are effectively, at the end of the day, conspiracies. So it's something quite interesting. It's like anyway, I'll stop. I was thinking about another example, but it's probably not relevant.
Thank you very much.
Brilliant. Thank you for this question, Keith. Gareth, you may have a question, right? No? Sorry, you're on mute. You're on mute now.
Got two mutes, got one. Yeah, no, my question would be, your study seemed to tie in quite well with my concept for a study. I put forward what I'm presenting tomorrow last year to do a PhD, and it was turned down. But when since I published it, it's become quite popular, and it won an award, which is ironic now. But it's to do with risk and planning for the thing that people say can't happen. And by the sound of it, taking into consideration people's ability to have no knowledge, but yet one of the big risks is no knowledge, but yet a massive platform to broadcast their opinion, is a huge risk to stop people listening to any idiot on the internet rather than the people that actually do the studies and do the. I put money on it that if you gave it to the right Kardashian, you could persuade pretty much anyone on the planet that wearing a pink tutu will protect you from coronavirus if they said it did. So yeah, I'm interested to look into your study and your gentleman and his opinion, because part of my research was based on the premise that coronavirus wasn't, as it was described with Black Swan, it was getting to the point where the World Health Organization kept publishing the same advice, 2002, 2009, that they were almost thinking, do you want us to do sock puppets or crayon drawings to word this, because we're just writing the same phrase each time and you're ignoring us.
Yeah, no, thank you. That's interesting. Indeed, there is something around risk, and I mentioned sovereignty leadership. So this was conceptualized by 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 the field, and really through really interesting papers, and leadership discourse seems to work differently also when there is a real crisis where people really need a response, I guess. But with this guy, the problem is that it's not that easy to say that he's anyone. He's not anyone, and he's one of the most cited scientists in terms of medical studies. In other words, this is the analogy I was going to use. It's like if you had it's probably not the good analogy, but it is still one. It's like having a sociologist talking about history or something like that. If you wanted to put in use an analogy in social sciences. So this is what is really disturbing. It's how he uses his status and probably the fact that he has done actual science to destroy science. Anyway, it's kind of basic point, but.
Thank you so much, Charles. Unfortunately, we have to move on, and the topic is absolutely interesting. And again, probably technology plays quite a significant role here in amplifying this populist message, and that would be interesting to see your take on that here.